calcium regulation is also under hormonal control. And where we'll see calcium in the body is that the majority of calcium is located in bones and teeth, about 99%. 1% of calcium is located in extracellular fluid. Now, calcium, we've already seen, is very important with regards to muscle contraction, as well as important in neuromuscular transmission. Something that we didn't highlight, but for you to be aware of, is that calcium also plays an important role in the clotting cascade or blood clotting. So the gland that's important for helping us regulate calcium, there's actually 4 small glands, and they're called parathyroid glands. So these are 4 glands that are located near the thyroid or beside the thyroid, hence the name parathyroid. So if this is our thyroid gland, we'll see that there are 4 glands, one located along each pole. The parathyroid glands secrete the hormone PTH, or parathyroid hormone. The rate of secretion of parathyroid hormone is controlled by the concentration of calcium in the plasma. If we have a decrease in calcium, that causes an increased secretion of parathyroid hormone. And if we have an increase in calcium, that will tend to decrease parathyroid hormone secretion. So there are calcium sensing receptors, abbreviated CASRs, and these sense hypocalcemia, and when they do sense the hypocalcemia, they stimulate parathyroid hormone secretion. So the various actions of parathyroid hormone, many of these occur at the bone. So as we learned in talking about growth hormone, there are cells called osteoblasts which create bone, and there's also cells called osteoclasts which dissolve the bone. So parathyroid hormone stimulates these osteoclasts, and that results in the release of calcium from the bone. Now realize that bone is made of a substance that contains both calcium and phosphate, so parathyroid hormone will cause an increase in calcium as well as an increase in phosphate. Parathyroid hormone also acts on the kidney. And on the kidney, what it does is it helps to increase the reabsorption of calcium. So when we increase the plasma calcium, more calcium is going to be filtered by the kidney. But parathyroid hormone doesn't let that get excreted. It actually causes changes within the kidney that increases the reabsorption. Now, parathyroid hormone is secreted because we have a low calcium level, but our phosphate level is perfectly fine. So when we increase parathyroid hormone secretion, and we increase both calcium and phosphate, although parathyroid hormone helps us hold on to calcium, it actually inhibits phosphate reabsorption, so we're allowed to excrete that with the urine. Parathyroid hormone also acts to stimulate the formation of calcitrol, or 1,25-dihydroxy vitamin D3. And calcitrol is important because calcitrol enhances the absorption of calcium from the small intestine. So if our calcium level is low, not only will we see an increase in parathyroid hormone secretion, and it will do its things to increase calcium, it also will lead to the release of calcitrol, which helps increase absorption from the small intestine. Calcitrol will also help to increase the reabsorption, along with parathyroid hormone, from the kidney. So both parathyroid hormone and calcitrol, they work in concert to maintain normal calcium levels.